A podcast here from the Social Television Network in downtown Phoenix. I'm Chris Coraggio, your host, and we have a couple of guests today, perfect guests, because our specific topic today, dealing with this COVID-19 pandemic and community leaders kind of pointing the way in the right direction and providing information and providing resources. This specific episode is dealing with the homeless. And so we have two folks from the Human Services Campus, Executive Director Amy Schwabenlender and former President and Board Member Mike McQuaid. And the Human Services Campus, which has been going for decades now, has 15, in some way decades now, but has 15 organizations on their campus. And everyone who comes through the doors at the Brian Garcia Welcome Center is screened currently for the COVID-19, screened in the fact of answering questions, obviously not tested, but answering questions, finding out if, in fact, they are showing symptoms, and if so, they are taken to isolated areas and dealt with appropriately with the medical personnel. The Human Services Campus is set up right now since there has not been great news. There has not been one person that has known to be positive of this virus. But if and when that happens, the Human Services Campus is set and ready to go with housing and social distancing measures and everything else that is now the new normal in our world. And Amy and Mike are working diligently. They have been very organized. They have been prepared due to many other illnesses that afflict the homeless. So maybe this organization, more than others, was, I want to say, sort of ready for something like this. And just by our discussion here today, you will certainly get that sense listening to Amy and Mike. So, Amy, how are you guys dealing with the high-risk campus population?
So really now our day room has become a 24/7 housing shelter program for the most elderly, vulnerable people that have chronic health conditions. And so we're working to get ahead of some large community spread and have people segregated. So those who are at high risk, those who are already sick with something, and those who are healthy and low at risk. And so by creating isolation tents in Circle the City's medical respite program and outdoors, looking at how to best use the space in the CAS shelter. The dorms in CAS itself have separation. So the men's dorm and the women's dorm each have 3 basically separate areas. And so we can start to compartmentalize people. And then using our day room, we're looking at how to use St. Vincent de Paul's dining room, because meals have been moved to being outside and in to-go containers. So here we're trying to figure out, my rough math right now today, and so it could change, is that maybe we could have 500 people here in one of those different levels of care, if you will. We know that there's probably 3,800 people that were counted in the point-in-time count in January that are unsheltered in Maricopa County. So for me, it's hard to answer that question and say we would never take new people in, because as people turn over, we're going to keep working on housing people in permanent places in the valley. There's going to be a number of unsheltered people across Maricopa County that have nowhere to go.
Yes.
And we want to be prepared to help them still do isolation, quarantine if necessary. But to leave 6 people out on the street doesn't seem like the right thing to do.
Mm-hmm, mm-hmm. But, it really sounds like at least you guys have adapted and evolved through this. With preparedness and organization. I'm curious, when 2 questions. When did you guys, as a campus, and you said it's 15 organizations there on campus, when did you guys start to gather and maybe come up with a plan of this? Was it in January?
Yeah.
Was it in February? And also, right now, are you fully staffed, or is some staff staying home?
So I'll answer the second part first. Some staff are staying home. Some programs on the campus have really reduced their hours of service, or they've ceased operating for a little bit of time until we all understand better how long is it's going to take. I have staff that have rotated from working remote if they're, administrative. The finance director has been home the last 10 days. so that we're not all here working, and if we do get sick, we're not all then out at the same time. So again, we continue, my HR manager is scanning what other companies and organizations are doing to see if there's best practice that emerges on staffing. The first part of your question now I already forgot. I'm sorry.
It was when did you guys start organizing for this? Yes. We've had a standing work group called the Communicable Disease Work Group because we've had to deal with things like hepatitis A and a flu pandemic in the past. So that group had been meeting monthly. I reported to the board recently, I really feel like our lives changed and business changed on March 9th. And that was the day we had a campus council meeting, which is where I host all of the executive directors of the partners. And that was where, I think the news had really picked up and our community's preparing, and it moved us into high planning gear, and started then with a different conference call and a face-to-face meeting. And now our core team is having a daily phone call at 8:30 a.m. Has people from Circle the City, CAST, Community Bridges, and the Human Services campus. Because again, we're all moving. We're trying to secure supplies. We're trying to, guess how long this is going to take, and we really believe we have to be over communicating right now. Definitely. When folks come through the Welcome Center, maybe let's put it on since March 9th. Since that's the day that you've designated, do you is it constant conversation with some new folks coming in, worrying? Do you hear worry? Do you hear concern? What are some of the things that you're hearing as they're being screened?
Yeah, I think the amount of worry and the amount of conversation has definitely increased over the last 2 weeks. And I think, people that have been unsheltered, living on the street for some amount of time, they have less information than other people. People who have newly fallen into homelessness, they seem to have more information. I feel like most of my job is about helping people remain calm and not panicking, and conveying that out through all of our staff, because people in homelessness are already in a crisis mode and they're already anxious, and adding this on top of it, we want to make sure we're meeting people where they're at mentally, and again, helping them understand what's going on and what can they do about it. What is this new term called social distancing? People don't even know what that is. Circle the City is also going to start with some of their medical team doing what they call patient town halls. And so where we're having people in these other spaces for sleeping and living, they'll have medical teams that starting today can go and sit with clients and explain to them what's the coronavirus and what are the symptoms and what can you do to protect yourself and what happens if you need to get tested. And I think that will be really, really helpful to reduce some of the anxiety.
So, and I was going to say,
go ahead, Mike. Go ahead.
That I liken this, what we do on the campus as far as staff and how we're operating, doing all the things we're doing, very similar to what the medical field is facing, in that, we cannot just shut the doors, nor would we ever do that. But we're making adjustments to try to protect staff as much as possible, to protect volunteers. We've really reduced the number of volunteers that can come to the campus. That's why meals are not being served outside at Andre House and things into the fall. We're limiting how many people can be in a room at one time, things like that. So it's just an ongoing thing, but it's incredible to watch the dedication of Amy and all the staffs, whether it be same as the Paul or Cass or St. Joseph Worker or Circle the City. I could go on and on to all 15. They are so dedicated that they are here putting their health and safety at risk to help people that really are not able to help themselves.
Yeah, that was my next question, Mike. From your perspective, just listening to Amy, just from my perspective, listening to Amy, it seems much more organized, and the Human Services Campus seems much more prepared than I even thought at the beginning of this podcast, because the whole world right now is kind of throwing their hands in the air like we've never seen this and we don't know what to do. We don't know you guys seem organized. You guys seem to have a plan, and I wanted to ask you, Mike, how proud you are listening to Amy explain, even on this podcast, what's happening and what will happen given the nature of this pandemic. Because I know you're a very organized person, and I would imagine sitting back and seeing this take place in something that's so near and dear to your heart, this campus, I would think you have to be encouraged.
No, very, very much so, Chris. And I think the word that you use, being proud, I'm extremely proud of everybody down here and everybody that helped create this campus and has kept it going, and being a part of the board from the beginning. It's extremely gratifying. It makes me proud. And I think, unlike everybody else, you're certainly concerned about your health and safety, but I almost have to come down here at some point most days, even if it's just to meet with Amy from 6 feet or more away, just to see how she's doing and what's going on. And I don't advise people coming down and handing out stuff on the streets or doing the things a lot of people used to do. But we are so better organized than I think most communities by a long shot. Now, we do have an advantage in that even though we're the 5th largest city in the country, our relative homeless population is fairly small compared to our per capita. And I think that's again a tribute to the last 15 years of the campus and all the providers in the valley that are working to help people in poverty and homelessness, that we are able to kind of pull together and organize and come up with plans and then implement them faster than any large city that I know of would be able to do.
And also, having said that, Mike and Amy, if you hear the medical experts, the infectious disease experts saying that there's a good chance that there's going to be a second wave of this virus at some point, whether that's in the fall and winter of this year or this time next year. No one actually knows, but they say that there is a good chance. Now, yes, we will have more therapies. Hopefully a vaccine will be available by that time. But from the homeless perspective, from fighting the plight of the homeless, where you guys are you already organizing for that second wave, just going by what you've learned so far since March 9th, possibly?
Yeah, I mentioned the point in time number of 3,800 unsheltered people, and there are other shelter providers across the community. We have a really strong network with, because we're a coordinated entry lead, which is a really technical HUD thing, but we have a network of 20 other access points. So I think as we're building a practice here on how to deal with the coronavirus, that we can also teach the other access points on ways to address this. And so will we ever be fully prepared? Probably not. However, I think we're establishing a good foundation and framework. And, and in my mind, I'm already thinking, we have to operate this way at least through December, because we don't know. And so preparing ourselves that this is not a 2-week thing or a 2-month type of operation. It's really for a longer term, and then we'll be ready to go back to our typical way of operating. However, I think we'll be better at operating because this crisis is forcing us to collaborate in each organization, focus on its strengths, and not take things on that maybe is someone else's strength. And so I think there is the silver lining out of this crisis that's teaching us all what. When a Mike McQuaid said, let's have a collaborative human services campus, now in our 15th year through a crisis, we're really seeing what collaboration looks like, and I think we'll be better afterwards.
Mike, well said, Amy. Mike, I'll give you the last word on maybe the silver linings Amy brought up. Do you see any specific silver linings? I know you're a positive person, but right now, looking forward, Amy said maybe through December these practices will remain in place on the campus. Maybe that is a silver lining. Maybe that will help in the overall challenge that you guys are facing every single day. What do you say?
I agree completely, Chris. I think that from the national scene, the international scene, I think everybody's the silver linings. We're all going to learn that when this happens, we have to be prepared for it. And we're going to be better prepared for it here at the campus and in our community, certainly at the end of this. And everybody does, I think, agree. It's not just going to be a few weeks or even a few months. we have to have this kind of preparedness kind of just ongoing. And that is a silver lining. If it's not the COVID-19, it's going to be something else as we go forward. And I think the world and the country and little old us in Phoenix, Arizona will be better prepared.
Well, I want to thank both of you, and definitely, the name of this podcast, which we just started, by the way, earlier this week. We have a bunch of podcasts here on the Social Television Network, but this one called Leading in the Moment was born because of this pandemic and this crisis. And just listening to Amy and Mike, you guys are leading in the moment. It is you were the perfect guests, because when it comes to the plight of the homeless here in the Valley, just listening to Amy over the last 20 minutes on this podcast, she is leading in the moment, and that's who we want out of our community leaders, providing that information, that guidance, that organization. Amy Schwabenlender, Mike McQuaid, thank you so much for joining us here on Leading in the Moment.
Thank you.
Thank you.
Okay, stay well.
You too.
You too. Thanks, Chris.